This is Rural Health Leadership Radio.
Episode 176, a conversation with Alicia Ekstrom, recruiting specialist at the Chautauqua Center.
Really, when it comes down to it, that's what really sells individuals, is that the meaning behind it and the emotion and the passion that I do have for the Chautauqua Center.
Welcome to the Rural Health Leadership Radio with your host, Dr. Bill Oxier. Each week, Dr. Oxier has a conversation with a different rural health leader to discuss what's working and what's not working in rural health, along with other topics of interest to rural health leaders. Rural Health Leadership Radio's goal is to improve health in rural America by providing a simple, no-cost means to share information and connect rural health leaders from around the country. And now, here's Dr. Oxier with today's guest.
Hi, everybody. I am your host, Dr. Bill Oxier, and welcome to Rural Health Leadership Radio. As many of you know, Rural Health Leadership Radio is a 501c3 nonprofit. And like most nonprofits, we're always looking for ways to pay the bills to support our mission. And it's not too late for you to make your tax-deductible donation before the end of the year. And right now, for any donation we receive, no matter how big or how small, half of that donation will go towards production costs for the podcast, and the other half will go into a scholarship fund. In the spring, we plan on awarding a scholarship to a high school senior who is going to continue their education to major in a healthcare-related field and takes a pledge to work in a rural health setting upon their graduation. And so in return for your help in achieving our mission and funding those two different areas, we have some gifts for you. In fact, if you make a donation of $100, we're going to send you 3 books. One will be a copy of my award-winning selling book titled To Lead, Follow. I'll also throw in a copy of Masters of Success. That was a Wall Street Journal bestseller that I'm a contributing author on. And then finally, we'll throw in a copy of the book, What Rural Health Leaders Are Saying. So don't delay. Make your donation today. Just go to www.rhlradio.com and click on the donation button. Today, we're talking with Alicia Ekstrom. Alicia is the recruiting specialist at the Chautauqua Center. It's in the state of New York, near the shores of Lake Erie. Welcome to Rural Health Leadership Radio, Alicia.
Thank you. Thank you for having me.
So tell us about yourself. Who is Alicia Ekstrom and what's your story?
Well, I was born and raised in Buffalo, New York, and I moved to the Chautauqua County area about almost 5 years ago. My hubby is from around this area, and so I moved just a short distance. We're about 45 minutes to an hour away, depending where you're coming from in the Chautauqua County area. So it's not too far from home, but I have always loved being outdoors, and within this area, there's so much, there's so many outdoor activities such as hiking, snowshoeing. We do cross-country skiing. We'll be taking advantage of once we get that white fluffy stuff. Luckily, we haven't gotten it yet, but we do embrace the winter as much as we can
Yes.
when it does come, which it will be soon.
You have to, where you live, you have to embrace the winter. You go a little stir crazy, I think, otherwise. So it sounds like you do make the most of that with all the outdoor activities that you do. And it sounds like it's you're blaming your husband for living in rural America now instead of in the urban area. Just joking there.
Yes. It's okay, though.
Anything else you want to add about who Alicia is?
I don't think so. I'm a foodie. I love food. I love trying new restaurants. I love supporting local businesses and meeting new people, and of course, spending time with family and friends.
Awesome. Thank you for sharing that about yourself. So, Alicia, why did you choose healthcare as an occupation?
Well, I have always been an individual ever since I was younger that enjoys helping others and really wants to make people happy and put smiles on others' faces. So I originally actually started, I went to college for occupational therapy, and then I transitioned into and graduated in 2012 with my health service management degree, which that opened lots of opportunities for me. And that's the reason why I did transition into that role. I've worked in various healthcare settings over the years. Prior to college years, I've worked at group homes, insurance companies. I volunteered at local hospitals. So I've dabbled my experience in healthcare settings in a variety of places.
Wow, you've packed a lot in. You've packed a lot in your lifetime. That's for sure. So
yeah.
Why the focus on rural health?
Rural health. So there's certainly a need for healthcare in rural settings. Rural health, I feel, is more of a challenging area, especially within healthcare and being in the recruiting role. I've noticed that it's harder to find specialists out this way, and for individuals, any providers that do want more of a well-rounded experience, rural health is definitely something that can be challenging and also rewarding in multiple ways. And you see a variety of people too, and not just as a provider, but just in any role you play in healthcare in a rural setting. There's certainly a need. I know within the Chautauqua County area, we struggle finding dentists, and specialists in the area are limited. Some folks out here have to travel about an hour away, depending if they're going to Erie or Buffalo, to see a cardiologist or a neurologist. And so having those, having access to those is extremely important.
Absolutely. Yeah, that's always a challenge. It's a challenge to get a primary care provider to serve some of our rural communities, let alone specialists like you're talking about. So I get that. As you know, Alicia, the name of this program is Rural Health Leadership Radio, and I emphasize the word leadership because my next question is, what's your definition of leadership?
I think that leadership is more so someone guiding a group of people and providing that support and direction using a professional and respectful approach, being that mentor for individuals or an individual, I would say.
Yeah, I love the idea that you planted right off the bat with your definition, the act of guiding. And so as you were saying that, I could picture you and your hubby out there on snowshoes or cross-country skiing in the act of guiding others, because, you know, the first time you do an activity like that, you do need someone to guide you and provide you with leadership. So that's the image I had in my mind as you were sharing that. Thank you for sharing your definition with us. Can you give us an overview of the Chautauqua Center and the community that you serve?
Our center is what's known as a federally qualified healthcare center.
Yes.
So what that means is we are funded through the federal government and state, and we're a little bit unique in the sense that we see everyone and anyone. We don't turn anyone away. We bill all insurances. We have a sliding fee scale that goes by an individual's annual income and the number of people that are in their family. We really try to provide options for our patients. So whether that be setting up a payment plan or asking them to fill out the sliding fee scale, or we have what's called care credit, which is like a credit card, and they'll put a certain amount on and pay that in a timely manner. But we're considered that one-stop shop for all. So we provide a comprehensive care, I guess, for all in the community. And it doesn't have to be just within Chautauqua County. We see individuals at nearby areas and counties, such as Erie County. We have some individuals that will come out to us. But we provide behavioral health services, primary care services, dental, substance abuse services, pharmacy management. We also we have couriers that deliver prescriptions to our patients, which is something that's been booming over the past year.
Yeah, that's cool.
Yes, that's definitely something that we are very excited about, and it seems our patients are as well, especially as the months get colder now.
Yeah.
And we're also able to offer our patients discounts on their prescriptions at a low cost rate. And that's something that they're saving hundreds and hundreds of dollars. And that's because we're federally funded. That's something that we can offer to them. We also provide nutrition education, pediatric care, women's health. We just hired our very first OBGYN.
Oh, wow.
And and we also have care coordination that are really the gears that keep us going within the organization. They're providing translation services and transportation services, and they're following up with hospital discharges daily. And then within 2020, we're looking to expand into chiropractic services, massage therapy, acupuncture services, vision services. So definitely filling some of the gaps that are in need in the area.
Yeah, it sounds like you got everything covered. I'd have to go back and hear everything you said again, but man, you covered a lot of territory for services that you provide. So that's pretty cool. I particularly like the fact that you have couriers that deliver prescriptions to people. That's a nice service to provide.
Mm-hmm. Yep, and that's free of charge too.
Oh, wow. Wonderful. Wonderful. So I know that you, since you're a recruiting specialist, obviously you're involved in getting all those specialties to come to your clinic. And when we talked before, you talked about the on-site interviews that you do. Can you tell us a little bit about the on-site interviews that you conduct at colleges?
So what I do is I speak with the local colleges' career centers. And I've been in touch with, in particular, the University of Buffalo, theirs. And what we do is I'll arrange a time to come down there because it's about an hour away, a little over an hour away. So I'll come down there for the day, and it'll be a couple months prior to students graduating in May. And I'll interview for multiple positions. And so I do that through their portal, which is called Handshake. And a ton of other universities and local colleges are a part of that as well. And we'll schedule any interview, whether it be the students reach out to me or the Career Center lets me know that they have someone that's interested. And then I'll meet with them for about a half an hour. And it usually goes for a half a day to a whole day, depending how many candidates we have that are interested. And after the interview, if the individual is still interested in pursuing employment and I feel that they're a good fit for our organization, then I'll follow up with a second interview with the department supervisor at our office, and then ask them to come down, check out our site, and meet with staff, speak with staff. We feel that that's extremely important because we want to make sure that they know what they're getting into.
Yeah, absolutely. So that Handshake sounds a little bit like Match.com, if you ask me.
Yes.
So that's how you first meet, and then you decide whether you want to meet them in person. So when you do that, you may have some specific positions that you're looking to fill, but I mean, it's kind of across the board positions that you're interviewing. Is that
correct? It's more of those positions such as dental and our medical providers and our licensed master social workers that are not as easy to find in the area. And the local university, they have wonderful programs that have tons of students that are graduating within those programs.
Yes.
So that's the reason why I reach out at that time, and more so for those positions to to fulfill, just because it's harder to find those in the area. And since it's the closest college, that's why I reach out to them first.
Understood. Thank you for sharing that with us. Now, you also talked about participating in virtual career fairs. Can you talk about that?
Yeah. Virtual career fair, that's one of my favorite ways of recruiting. It's probably the most unique way of recruiting that I've done so far. And what it is, it's a platform, it's a network of a whole bunch of students or residents or individuals that have already graduated and have already began practicing. And what happens is it's divided into the particular regions of the U.S. and the certain time zones, and you're placed in, I would be placed in a networking room, and my time, I would have about 10 minutes to share all about the Chautauqua Center, all the good things. And then at the end, there's some time for questions. However, it's pretty challenging just because usually it takes me about 45 minutes to an hour to share everything about the Chautauqua Center. So it's a challenge to share about 10 minutes worth. But what happens after that is after the questions, there's a networking room and you can go in there. Usually the virtual career fairs are from 7 o'clock till 10 o'clock at night. So you have that whole evening to go in the networking rooms and network with individuals that may have not asked questions, and you can share information about your center and recruit individuals that way as well. So it's kind of set up like an AIM chat session. But we've recruited a couple of people from those, and it's really just a great way to meet many people across the U.S. all at once.
Yeah, it sounds like
the jackpot.
And so it sounds like anybody from around the country can partake in this, both from applicant side as well as the recruiting side. Is that correct?
Correct. Yes.
Okay.
Yes. And that's something that's put on through, it's hosted by our funders, which is the Health Resource Service Administration. So that's another perk of being federally funded. That's something that we can offer because we do also have our student loan repayment program for medical, dental, and behavioral health staff, and licensed staff, nurses, registered nurses, and lots of providers and physicians, as well as registered nurses, take advantage of that.
Okay, and so when you talk to people in this virtual career fair, is it like a chat room, or is there video at all, or is it simply chat?
No video. So what happens is it's me over the phone, and I speak over the phone, and then on the screen, set up like a Zoom meeting, and on the screen there's a slide that shares my information, my contact information, my role, and then what positions we're hiring for. And then in the background is what I'm sharing.
Great. Okay. Well, thank you, Alicia. Right now, we're going to take a short break. Then we'll be right back to continue our conversation with today's guest, Alicia Ekstrom, the recruiting specialist at the Chautauqua Center. Alicia was just talking about the virtual career fair that she participates in via Zoom calls and how effective it is. You know, virtual meetings can be an excellent way for others to connect without the hassle or the inconvenience of travel. In fact, that is exactly how the Rural Health Cafe Mastermind Group meets. We meet every other week for 1 hour. Now, how would you like to support a worthwhile cause and simultaneously grow as a leader? Well, that's exactly what the Rural Health Cafe is all about. We bring rural health leaders together virtually to collaboratively grow as leaders. And there is a small monthly fee to belong, but 100% of that fee goes to support the mission of Rural Health Leadership Radio. Now, we currently have an opening in one group, and we're starting a new group exclusively for rural hospital CEOs. So regardless of whether you're a CEO or not, we have a spot for you. Now, our current group has a lot of diversity in it. It does have one rural hospital CEO. It has a CEO of a rural health clinic, but it also has a sonographer that works at a rural hospital, as well as a department manager, a former chief nursing officer that now is a consultant. We even have a theology major and a MHA student. So we have great variety in that group. And with the new group, that will be for CEOs only, but maybe there's another group you want to start. I'm all ears on any ideas that you might have. So if that sounds interesting to you, if you think you might be interested, even if you're not sure, but it sounds you might just be curious, just send me an email to bill@billauxier.com. That's BILL@BILLAUXIER.com. Each group is limited to 10 rural health leaders, so don't delay. Email me today. We're having a very interesting conversation today with our guest, Alicia Ekstrom. Alicia is the recruiting specialist at the Chautauqua Center in New York, the state of New York. You know, a lot of people, when you think of New York, don't necessarily think of rural, but it's a pretty rural state outside of the major cities there. But right before the break, Alicia, you were talking about the virtual career fairs you talk about. Can you talk about the 716 Well-Connected or 716 Well-Connected? I know it's a program that you started. Can you share a bit about that with us?
Yes. I am very excited to share this. This is kind of my baby at this point.
Okay.
And we had an event this past September, and it was a hit. We had 17 local providers that came near and far. Some traveled actually 45 minutes to attend. And what the purpose is 716 is our area code. So that's where the 716 comes into play. But the program's purpose is to bring local providers and specialists together as our area's healthcare providers networking group. This group has dwindled over the years from what I've come to learn from other providers and speaking with providers in the area. So I've arranged this more so for providers and specialists, healthcare specialists to meet, because we are hiring newer specialists, and not just the Chautauqua Center, but other healthcare organizations in the area. And a lot of the times we don't know that there are these new specialists, such as an ear, nose, and throat physician that joined, and so forth. So I am looking at it as hopefully a way in the future to reconnect and meet with healthcare leaders, collaborate between healthcare professionals, and for them to discuss, and everyone to discuss, the key to quality of care for all patients. It is a free event, and it's more set up like a networking kind of event. But I would like to make it more informative as well. We had, as mentioned, about 17 local providers that did come to September's, and I plan to host 2 events each year. And then I would like to expand this program in the future, including residents finishing up their final year and inviting residents from local colleges such as UB, in hopes to, as it is a way to recruit physicians as well, and also show them the area and what good things we have going on in Chautauqua area, since we're a hop, skip, and a jump away from Buffalo area.
Yeah. So is part of the idea here a way to, some of the specialists that are in Buffalo or more their practices are urban, but that your local providers refer patients to, is part of the intent to connect those people?
Yes, exactly.
All right. Well, that sounds like a cool program. So congratulations on getting those 17 providers to your first event. I look forward to hearing how it goes in the next 2 or 3 events that you've got planned for next year. Part of this program, Alicia, is sharing best practices. And so you're in the recruiting business in rural healthcare, and that's always a hot topic, recruiting the professional staff needed to serve our rural communities. Do you have any best practices that you can share with us that would be help our listeners out?
Yes, I most certainly do. I would say really try to connect with the individual on a more personal level, and that I've noticed just makes them feel more comfortable and not as they're not looking at you as a sales woman or man.
Yes.
I love my job and I love the organization that I work for. So that seems to help too. I have been told that you can hear, the passion in your voice and the emotion, but really when it comes down to it, that's what really sells individuals, is that the meaning behind it and the emotion and the passion that I do have for the Chautauqua Center. And we have a lot of good things going for us. And so I always try to expand on that, but I also like to include their family members, especially if some are relocating and they're visiting the area for the first time. I let them know, bring family members or bring your spouse or your significant other for the interview, as well as the visit and the tour of the area. I also like to connect with them on their hobbies and see what fits within our area too. And so it's more of, I'm not a good saleswoman. I don't want to be that person that sounds like a car salesperson.
Yes.
And so I try to connect in that way. And I speak from the heart, I guess.
Yeah.
And then also just never rush the process, give the individual time. And I don't like to be constantly sending them emails and calling to follow up. I just let them reach out to me when the time is right for them.
Yeah, I appreciate you talking about the spouses, because sometimes I was talking to a CEO of a critical access hospital in another state the other day, and he was talking about how recruiting is more recruiting the spouse than it is the provider or the professional person you're targeting sometimes, because it's obviously important part of the process. Alicia, I don't know about you, but I like telling success stories, right? Things that I've done well, but the reality is we often learn more when we try something new and it doesn't necessarily work out the way we planned it. Some call it failing forward. I just call it lessons learned. Do you have any lessons learned that you can share with us, particularly as it relates to recruiting?
Yeah, I would say lessons learned, always, and this is very simple, but especially when I started off as a recruiting specialist, I didn't get in the habit of always taking down individuals' names and phone numbers. And just one in particular, I didn't take down the name or phone number, and it was for a dentist. And I was kicking myself in the butt, and I was investigating, trying to do everything I could to track down this individual. And luckily they reached back out. But after that, I have always made a mental note, always take down an individual's name, phone number, and contact information before hanging up, because that might be a opportunity that could have been something that could have benefited the organization.
Yes, there's nothing more frustrating than to realize you've only got one way of trying to reach someone who said that they were interested in talking to you, but when that one channel of communication doesn't work, if you don't have any other options, that can be very frustrating sometimes. So thank you for sharing that lesson learned with us. Alicia, what scares you the most about the future of rural health?
I would say that, I guess, the reduction of health disparities.
Okay.
So reducing the health disparities among rural areas, the quality of health in our area by the presence of disease or health outcomes and access. Those scare me just because we are limited with access and healthcare access, and specialists as well. Also, individuals' nutrition is also a concern, just because it's easy to get McDonald's, especially in rural areas. You're
Yes.
more so limited to the more of the fast food places, or just quick on the go kind of foods. And so always trying to support our public markets, our farmers markets, and supporting the local farmers. It's really, really important, especially in a rural area.
Yes.
And then also funding for programs, which that's something that can also play in part of individuals' nutrition and their health.
Yes, some major concerns there. So thank you for sharing that with you. Well, let me flip that question around and ask you, what excites you the most about the future of rural health?
I think what excites me is, in particular within Chautauqua area, right now we're growing and revitalizing in many ways. And we're adding coalitions and health and wellness committees that are forming to really better the health of our community. So right now we're in baby stages in some of them, but I think in the next couple of years or down the road at least, we'll see more of just making healthier choices and more support. That's what I've seen just within the past 5 years of living here in a rural health setting. The running population is even growing, and the cycling, and just individuals are more conscious of their health. And so hopefully that still sticks in the next couple of years.
That is exciting, isn't it? So we've covered a lot of territory in the short time we've been talking here, Alicia. If our listeners only take one thing away from our conversation today, what should that be?
Rural health areas can't be forgotten about. We do exist, and we have our challenges. And I think too, encouraging locals in rural healthcare settings, speaking from a recruiting point of role, I would say encouraging locals to stay in the area and be proud of the area that they live in, and getting involved as much as you can.
Alicia Ekstrom, the recruiting specialist at the Chautauqua Center in New York, thank you again for joining us today.
Well, thank you very much for having me.
I want to thank you for sharing your expertise and firsthand knowledge about recruiting in rural health. And I want to thank all of you out there for listening today. If you enjoyed today's episode, please go to iTunes, Stitcher, Google Play, whatever your favorite podcast app might be, and subscribe to Rural Health Leadership Radio. And if you'd like to continue the conversation of leadership in rural health, you can also join our LinkedIn group called Rural Health Leadership Radio. And while you're on Facebook today, we love likes, so check out Rural Health Leadership Radio's Facebook page and give us a like. Until next week, let's keep working to improve rural health, one conversation at a time.
If you would like to connect with today's guest, please send an email with your contact information to bill@billoxier.com. If you would like to be a guest or suggest someone else as a guest, have a question you would like to ask, or simply want to contact Rural Health Leadership Radio, please use that same email address, bill@billoxier.com. That's BILL@BILLAUXIER.com. You can also visit our website at www.rhlradio.com.
And we'd ask that you please support our sponsor, the Dynamic Leadership Academy for Rural Health. The Dynamic Leadership Academy for Rural Health's mission is to improve rural health, one leader at a time.